Have you ever stopped to think that some of the test results you get after turning 70 might not actually mean what you believe they do, and that misunderstanding them could either scare you unnecessarily or make you ignore something truly important, putting your health at risk without even realizing it? The truth is that as we age, the body changes in ways that most standard medical charts and numbers don't always explain clearly. And while your doctor may tell you the basics, many seniors still misinterpret these results at home, leading to unnecessary fear, stress, or even wrong decisions about diet, medication, or lifestyle. For example, take blood pressure readings, something almost every senior keeps track of, because doctors emphasize it so strongly. But what many seniors misread is that a slightly higher top number, systolic, is sometimes normal after 70, since arteries naturally stiffen with age, meaning that not every high reading is a crisis. Yet many seniors panic and either rush to the ER or overload on medication, which can drop pressure too low and cause dizziness or dangerous falls, something far more common than people talk about. Another misunderstood test is blood sugar levels, because while fasting glucose is important, older adults often don't know that strict normal ranges are not always realistic after 70, since a slightly elevated sugar reading might not be alarming if overall health is stable. Yet many seniors punish themselves with extreme diets, skipping meals, or overusing medication, which then causes low sugar crashes that are far more harmful at this age. The same applies to cholesterol tests, because many seniors misinterpret the numbers, thinking that every bit of high cholesterol is life-threatening. When in reality, doctors now know that after 70, balance matters more than perfection, and slightly higher cholesterol can even protect the body in certain ways. Yet seniors often stress and cut out healthy fats like olive oil, nuts, or avocados, leading to weakness and poor brain health, when what they really need is a personalized approach, not blind fear of the numbers. Then comes kidney function tests like creatinine levels, which seniors misinterpret often, because these results can look worse simply due to natural muscle loss with aging, and not necessarily because the kidneys are failing. But many seniors panic when they see abnormal numbers, even though doctors usually look deeper into trends, hydration, and other markers before making conclusions. Finally, one of the most misread tests after 70 is bone density scans, because seniors often believe that any decrease means they will definitely break a hip or be unable to live independently. But that's not always the case, since bone density scores can be misleading if you don't also consider muscle strength, balance, and lifestyle factors, meaning that numbers alone don't predict your future as clearly as you think. The truth is, seniors across America often misread these 5 common test results: blood pressure, blood sugar, cholesterol, kidney function, and bone density, because they see the numbers without the context of aging, and this leads to anxiety, unnecessary lifestyle changes, or even dangerous choices with medication. So the real wisdom after 70 is to stop letting single test results scare you, to always ask your doctor what those numbers mean specifically for someone your age, and to remember that numbers on paper don't define your health, your independence, or your quality of life, because life after 70 should not be about chasing perfect charts, but about understanding your body in its natural stage of aging. So next time you look at your test results, instead of jumping to the worst conclusions, take a breath, ask questions, and see the bigger picture, because that's how you truly protect your health and keep living with strength, clarity, and peace of mind after 70.